Hi, this is Dr. David Green with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today I'm out at Fountain Hills, Arizona, a city just outside of Phoenix. Absolutely gorgeous out here. They have a large fountain a few miles that way. It's one of the tallest fountains in the world. The topic today is one that I find amazing, and it's treatments for diabetic neuropathy, which is the most common form of peripheral neuropathy. And to get really super technical about it, it's a small fiber neuropathy. So millions of people in America have diabetes. The World Health Organization predicts that by the year 2025, so my simple math means less than about a dozen years from now, 13 years, a third of Americans will have diabetes. That's amazing. That's about 100 million or so people. That's as many people last year they found that had dealing with chronic pain, a third of Americans. With diabetes though, most people have significant problems from it before the diagnosis is actually made. So you make the diagnosis, you control the blood sugars, you've still got a humongous problem, right? Because the peripheral neuropathy and things like that, they've already taken effect. So when people come in to the doctor's office and they say, I have really bad burning and tingling and numbness in my hands and feet, a lot of times that's from peripheral neuropathy that you can't reverse it. So what can you do about it? Well, this is the interesting research that just came out. So to control pain from peripheral neuropathy, there are some medications that can help. Opiates don't work really well, but they can help. There's also some neurologic modifying agents that have been shown to help as well. And there's physical therapy, there's some injections, things like that. But this is what the study that came out just looked at. Spinal cord stimulation for peripheral neuropathy, specifically diabetic neuropathy, has worked really well in past studies for pain relief. Okay? So what it does is it sort of tricks the brain into perceiving differently the way that these pain signals come in, so patients have less pain. And the recent study out of Evansville, Deaconess Hospital, looked at quite a few patients with this problem who got spinal cord stimulation. And they found that 85% of them actually had improvements in their sensation. And 58% of the patients in the study had a complete reversal of their loss of sensation in their feet. And isn't that unbelievable that a spinal cord stimulator actually not only just helped with pain, it helps with pain in over 85% of these patients, but it helped reverse the sensory loss. That to me is incredible. So what you have is you have pain reduction and sensory reversal. Here's one of the problems you can get with sensory loss when you're a diabetic and you have neuropathy. You can't feel very well, so you start to stumble, so you can fall more easily. Another thing that can happen is if you can't feel heat under your feet or unevenness or something like that, you can actually damage the joints in your foot. If it gets bad enough, there's actually a name for that. It's called a Sharkofoot. It can lead to severe arthritis and a big problem. You can get ulcers on your foot and things like that. So the fact that spinal cord stimulation handles both sides of the equation, pain reduction, and brings back some sensation, is amazing to me. So Arizona Pain Specialist does spinal cord stimulation with double board certified doctors who are fellowship trained and have done hundreds of these implants. You have to get a trial implant, which they do, and the final implant. These are not cheap devices, but they are covered by insurance, with proper approval. There's a lot of information on the website at PreferredPainCenter.com. Just click on education, you'll see a lot about everything: peripheral neuropathy, disc problems, sciatica, some narrated animations, and then we have our YouTube channel as well. Call us for help at 602-507-6550, and takes a lot of insurances and multiple clinics all around the valley. I'm Dr. David Green with PreferredPainCenter.com. Your pain stops here.